about some work the Health Foundation has done recently looking at international examples of where different regions or countries have tried to work more cross-sector and at different levels of government to implement what we're calling a health in all policies approach. It's not always been branded as that in these countries, but looking for what we can learn from other countries and what we can use for the UK. So the Health Foundation is a charity. We're all about improving health and healthcare in the UK and trying to not only influence policy but also understand what actually works on the ground and link those two together. And our Healthy Lives strategy is focused on the wider determinants of health. So we're increasingly trying to influence decision makers to put more emphasis on upstream measures that improve health from a wider determinants perspective, and we're doing that through trying to shift the conversation to promote national policies and also to work with local areas and understand how we can embed place-based solutions on the ground. And I'm going to talk about I'm not going to talk about 9, I'm going to talk about 3 case studies, but we commissioned an organisation called the UK Health Forum to do 9 case studies of different places in the world that have done interesting things to try and improve health in their areas. And when we looked across these 9 case studies, there were some key themes that came out, and the themes were very broad, but they were quite prominent in all or most of the case studies, and we felt that they do give us some interesting learning points from both a sort of a high-level theoretical perspective, but also the practicalities of what happened in those places that we can apply to the UK. And we were really interested when we did these case studies to not only find out what worked and what had helped to facilitate change, but also what hadn't worked. So I'm going to talk about 3 themes. One is leadership, politics, and events. The second is about knocking down walls and building bridges, so getting people to join up their working, whether that's at a national, cross-government level or in local areas. And finally, framing and working with communities and involving the communities. And the first of our examples is a case study in Paris, which is a really good example of that high-level leadership, but also how events can make dramatic changes. So Paris has a history of being progressive on the environment, and in fact the national government had implemented legislation over the course of the 90s and the early 2000s to improve France's environmental policies and activities, and Paris had created an action plan for the climate, which was the first in the country, and that was in 2007. And that was to do with leadership. There was the mayor, which is the most senior political leader in Paris, was very much bought into this idea, and there was leadership from the top, and including support from the national government to introduce an action plan that was going to improve the climate, including improve air pollution in Paris. And the plan had various approaches. It included reducing speed in the city to try and encourage people to drive vehicles more responsibly, or to switch to more sustainable forms of transport, and included other policies that might help to encourage people to travel more actively using public transport. This was the time when the Vélib scheme came in, which is the Paris equivalent of the Santander cycles in London. So there was a package of policies, but it became apparent as the plan progressed that they were not going to reach their target, which was a 60% reduction in air pollution emissions by 2020, so between 2001 and 2020. And the national government had introduced some legislation which would have enabled Paris to implement a low emission zone and restricting polluting vehicles from the city, but Parisian authorities felt that wasn't feasible, there wasn't buy-in for that, so it didn't happen. But then 2 key events happen, and this is where we come to not only needing that leadership from the very top, but how events can create these policy windows that can really dramatically move things on. And the first was in 2014, a very high pollution episode in Paris, which was very visibly clear to Parisians and people around the world that air pollution was a problem. And also the new mayor came into office about a month later, and she was really ambitious about making change, not only tackling these emergency high pollution episodes, but putting something longer term in place. And so she led the way in developing the low emission zone in Paris, which was part of their renewed climate action plan. These are stickers. Now every vehicle that drives into the centre of Paris is required to have a sticker indicating their level of air pollution, and the restriction bans the most polluting vehicles from the centre of Paris at certain times of day and days of week, and those measures are getting more stringent as time goes by, so it's being continually developed. But it has, people we spoke to in these case studies did feel that this low emission zone combined with the other policies, so enabling people to travel more sustainably, had made an impact, and they've seen a 50% reduction in pollution on average since 2014, and also a significant reduction in greenhouse gas emissions, and they've seen uplift in people walking and cycling and using public transport. So it does seem to have had an impact. However, of course, it wasn't perfect. One of the criticisms that was levelled at the mayor was that she hadn't brought the public on board sufficiently and she hadn't engaged with the media. And this is a quote from her when she was interviewed about her plans. She says, "Instead of wasting time and energy trying to convince through an elaborate marketing campaign, I deliver real solutions that speak for themselves." And of course, more recently we've seen widespread protests across France to do with rising fuel prices, and similar arguments have been levelled at the national government that they are part of the urban elite and they don't understand the real people and the needs of the people. So it's a really, really important lesson there. I'm going to move on to talking about knocking down walls and building bridges. And Norway introduced a Public Health Act in 2012 as a means of joining up departments at all levels of government, from national down to their local government. And the history behind this was that Norway, like us, has regional authorities that have public health responsibilities. And in fact, Norway's regional responsibilities had explicitly included a health in all policies duty. But around 2010, a minister in the national government wanted to introduce a national Public Health Act, and he was a health minister, and he saw the health sector as having a key role, and he wanted to attract more resources for the health sector to be taking a lead on prevention. And people in local and regional areas in Norway lobbied the government because they were really concerned that such an act would undermine their efforts over the previous few years to join up services and work across government in a health in all policies way. And they successfully lobbied the government. So in 2012, the Act came in, and it was an Act that applied to all sectors, to all government departments at national, regional and local levels. And of course, you can see these had these 5 principles, one of them being health in all policies. And people that we spoke to in the case studies felt that this Act had had a significant impact on the way that Norway joined up its services. So at a national level, people told us that it had created this obligation, this mandatory obligation of governments to take health into account. And this quote here saying, if you're talking to a minister or somebody in a different department and they don't want to assess the health impact of their policy or their proposed action, you can go to them with this Act and say they are actually obliged to do that. And people felt that had been really powerful lever for making change. And also at a local level, there had people described them starting to see joined up working as a result of the Act. So people had employed public health coordinators who worked in a similar type of way they described to directors of public health, who worked across departments, explaining to people the importance of different sectors in health and how they might be able to work more closely and more efficiently work together to improve health in their areas. So this is a really interesting example, but one of the things that people commented on was that while people felt this had really helped to join up services and to create some momentum around joining up services and awareness of the wider determinants of health and how important other sectors are in health, it hadn't always been followed with resources. And people told us there's an inadequate link between what is decided and what is implemented, and they're trying to link their budget to new interventions. And one of the things people said was that while there had been more joined up working and many areas had this public health coordinator role in their areas, they hadn't necessarily seen that actually make be actually translated into interventions, but that was partly because of a lack of resourcing. So really highlighting this need to not only try and join up and use legislation from a national level, but also appropriately resource, and especially where the needs are greatest or where the gains can be greatest. And finally, framing and involving the community. So not only is it important, obviously, to listen to the needs of people and listen to communities and work with communities to design things, but also important to think about how do we frame public health issues, how do people understand health, and how can we get people talking more about the social determinants of health, and those things being really important. And there's a really interesting case study from the US to do with prisons and reoffending. So since Reagan's administration, levels of the prison population had really rocketed in the US. People described this as a tough on crime, war on drugs approach, and there was a lot of concern during Clinton's years of this growing number of not only people in prison, but growing levels of people who were released from prison and then reoffended and were returned to prison. And of course, it has very significant health implications, not only for the individuals, but their families and their communities and society as a whole. So there's a lot of work going on behind the scenes to try and understand what is the cause of this and how can we change it. But a lot of the professional view was this is a social justice issue. This is a systemic problem. There's not going to be an easy solution. And what was described in the case study was that people took a little bit of a stance of nothing works. There's nothing we can do until we've resolved these social justice issues to help this problem. And that meant that not very much happened on the ground. So even though there's lots of work behind the scenes, nothing really changed or was implemented. But that really changed in 2004 when George Bush gave his State of the Union address. And he was really interested in this issue. And then he framed it in a completely different way to the social justice argument. So he said, America is the land of second chance. And when the gates of prison open, the path ahead should lead to a better life. And he was framing this in Republican values, so in their values of redemption, forgiveness. And suddenly this issue resonated with a much greater sector of Americans than just the people who are interested in the justice around it. And this really led to a change. So they introduced the Second Chance Act a few years later. And then when Obama came in, they introduced a council that involved elected officials and civil servants at national level from across all departments of government to work towards improving prospects for people who are leaving prison. And some of their successes were that they removed a box when people were applying for jobs, federal jobs, who had been in prison. There was a box that was ticked about, have you got a criminal history? And they worked to remove that. So now that they only do criminal checks after an employment offer has been made. So that they felt was a really significant step towards improving employment prospects for people who are leaving prison. Another thing they did was clarify policies around access to social housing for people who had a criminal record. And again, that seemed to have really helped change the way people who have been in prison could access housing. And rates have declined of people in the prison population has declined in the US, and people felt that this council, this cross-government council, has been part of that. Of course, one of the key limitations here is its complexity. This is about obesity, as I'm sure you all know. But it applies, of course, to prisons as well, and it's not, having a national council and reframing the debate is not the only thing that's going to make a difference. There has to be many sectors involved, and one of the problems in the US is the fragmentation of the system and the public services that mean much more needs to happen for it to be fully addressed. So I'm almost finished. In terms of the implications for the UK, these are very high-level themes that came out of these case studies, but we do know there's really innovative work already happening in the UK, and so they link very closely to things that we're already talking about. So, for example, do we need a UK-wide legislative framework? In Wales, for a number of years they've had the Future Generations Act, which is put a legislative approach to joining up working. So is that something that might benefit the UK? But then if so, how do we ensure that resources are allocated to local areas? And could the government introduce new measures of success? So at the moment there's an emphasis on economic indicators in terms of how we allocate resources. Can we change those to include some health and well-being metrics in there? What systems and structures are needed to enable place-based approaches? So we've seen, for example, in Norway, in local areas, there's been a lot of joining up services, and we've seen that in the UK as well, for example, in Greater Manchester and other areas. But what can national government do to facilitate that, and what can local areas do to effectively join up their services? And then finally, on this framing issue, how can we rethink how we talk to people about health and how people understand health, and develop that understanding among people that the social determinants of health have a huge impact on them, and we can do a lot to improving health and well-being by changing those factors. And it's not all about the NHS, and it's not all about individual responsibility and lifestyle choices. And so how can we shift that conversation? So thank you very much. That's it. We've got our, the full collection of case studies are going to be published in the summer, so do look out for them. And we have our and yeah, of course, go on our website if you want to find out more information. Thank you.